Sure. Mental health disorders in pregnancy are extremely common. About 1 in 5 pregnant patients will have some sort of mental health disorder, either before their pregnancy, during their pregnancy, or after pregnancy. So it's something that a lot of our patients have. In terms of kind of what's the difference between all of these mental health disorders, for generalized anxiety disorder, it's usually when patients have symptoms where they have a hard time relaxing, they feel anxious, they feel like their mind is always racing, really worried about the future. And it's when symptoms last for more than like 6 months. We do have certain diagnostic criteria. So when patients come in, we'll usually have them fill out a paper to try and figure out, what's going on, as well as talking to the patients. In terms of depression is when patients have like a down or depressed mood. They don't have a lot of energy or drive to do a lot of things, have a hard time taking care of themselves. And that is usually if it's going on for more than 2 weeks. And kind of the pregnancy time frame, a lot of times patients actually, their postpartum depression will actually present when they're pregnant or when they're getting closer to the time of delivery. And postpartum depression is when symptoms of depression last for more than 2 weeks after the time of delivery. Postpartum blues is a pretty common thing that people might hear or that we see, and it's usually after the birth of their baby. Their hormones might be kind of feel like they're on a roller coaster ride, and usually that's really normal within the first 2 weeks. And then if it's lasting longer than 2 weeks, then that is where it would be considered postpartum depression. All of that being said, if this is not a cookie cutter diagnosis, so if patients come in and they are having issues with their mental health, if they're concerned about it, it's always best to bring it up to the provider so we can talk to the patients and try and figure out what's going on, and then decide what the best plan of care would be, whether it is getting them tied into behavioral health therapy, starting on a medication, making sure that they have enough resources at home. And then some really, really rare things that can happen after delivery or on the time of delivery. One would be postpartum psychosis, which is extremely rare. And that's where patients hear voices, or they might be seeing things that aren't in the room. And then they have a hard time having like any insight of like what's actually going on. And then another one that's pretty rare is postpartum OCD, or obsessive compulsive disorder, where patients will have a really hard time doing simple tasks of taking care of their baby, whether it's they're afraid to give their baby a bath because they're afraid their baby might drown. They're afraid to go down the steps with their baby because they're afraid that they're gonna fall. They are afraid to go down a certain road because they're afraid they're gonna get into a car accident. If patients are struggling with their mental health and they're noticing an impact on being able to take care of themselves or their babies, we wanna know about it sooner rather than later so we can assess the patient, talk to them, and try and figure out what's going on. ADHD, or attention deficit hyperactive disorder, or ADD, are pretty common things that we see. I think about 4% of women have it. It's probably underdiagnosed. There's probably more than that have it. And that is not something that I diagnose. That's something that would need to be diagnosed by either a primary care provider or by a psychiatrist. A lot of times for patients that have ADHD, they're on a medication to help with their functions of their daily lives. And if patients aren't sure if they should stay on their medications or not while they're pregnant, usually the answer is to stay on any mental health medications that they are on and while they are pregnant, and then talking to an OB/GYN to see if there's anything special or anything else that we should be doing to monitor the pregnancy. In terms of ADHD medications in general, usually it's a conversation to have with the patient and how much the ADHD is affecting their life, and how they do without the medication, and it's a kind of a shared decision making based off of how much the medication is helping. As a provider, I think it's very important for providers and doctors to be very transparent and open with patients, so we can safely take care of patients, whether it's during their pregnancy or after their pregnancy. At Sanford, we have a lot of resources to get patients to their clinic visits, as well as resources in clinic. If patients are having a hard time navigating being a new parent, we have actually a behavioral health specialist in our clinic that can see the patients that day, or at least give them a call within that day or the next day. In regards to people that have concerns with bonding with their baby, this can be sometimes a common thing where patients, don't feel like they're a parent or they have a hard time bonding. And that's something we would want to know sooner rather than later, because sometimes it could be a sign of something more severe that we would want to look into and further evaluate. So I think it's important for the patients, if they have any concerns or if they're like, this doesn't feel right, to let us know so we can further evaluate it. When it comes to mental health disorders in pregnancy, again, it's extremely common. 1 in 5 pregnant patients will have some sort of mental health disorder during pregnancy. The majority of deaths around the time of pregnancy within the first year after having a kiddo are due to mental health disorder. So whether it is accidental overdose or suicide, those are the most common causes why people die during either childbirth or after having a kiddo. There's been a huge swing towards keeping patients on medications that they were previously on for their mental health in pregnancy, as well as making sure that patients have resources to safely manage their mental health, because it is such an important part of care for pregnant patients. When it comes to if patients aren't sure if they should stop medication or not, they can come and see us before they're trying to get pregnant, and we can have a conversation with them before to see if it's a medication that is safe to be on pregnancy, or if we should just have them continue it. Or if they find out that they're pregnant, they can always call and ask. And that's something that we can usually look at and then get patients into clinic sooner rather than later to have a conversation on what they should do with their medications. But usually when it comes to mental health disorders, the recommendation is to stay on your medications until you see an OBGYN, and then we can have a conversation with the patient. I think one is trust your gut. If something feels off, then to reach out and to let either a physician know, a nurse know, or a therapist, so we can evaluate you to see if there's anything else that's going on, to see if there's additional resources that we can provide you with. The big thing that I say is if you're having a hard time taking care of yourself or taking care of your baby, those are big red flag signs. So if you're having a hard time eating or showering or getting dressed in the morning, or if you're having a hard time changing your baby's diaper or going to pick up your baby when your baby is crying, those are signs that those are red flag signs that we would want to know about. The other thing is that if something doesn't feel right, to let us know and to trust your gut. And then we can have you come in to get evaluated to see what we can do to help you through this transition.